Well, on to tonight's top story, a shocking admission from the head of the FDA. In congressional testimony, Agent Chief Margaret Hamburg said she's almost powerless to protect us from dangerous drugs like the ones from a Massachusetts company blamed for the deaths of 53 people. You've heard about this one. That word coming in after a week full of shocking reports describing deplorable conditions and a lack of oversight at what they call compounding pharmacies across the country. So, once again, the FDA can't guarantee one of their most basic functions, the safety of pharmaceutical drugs. Republican Congressman Tim Murphy of Pennsylvania is the chairman of the House Oversight and Investigations Subcommittee. He joins me now. Congressman, welcome to the show. Before we get to you, I just wanted to describe what compounding pharmacies are. These are folks who specially blend drugs for people. Maybe they can't take a pill form, they have to take a liquid form, but this business has gotten completely out of control. It's now 3% of all production in this country. Where is the FDA on this?
Well, the FDA could have been there, but they made a decision in 2011 and 2012 to stop inspecting the New England compounding pharmacy, the one that developed the injectables that had the fungus inside them. Look, the FDA could have gone in, and we asked repeatedly, Commissioner Hamburg, why did they stop inspecting? Who made the decision? Did anybody review this? After it was all done, did she sit down with staff and say, why was this done? We couldn't get a straight answer. What is also interesting, however, is while she was saying her hands were tied with laws, she announced in a flurry of publicity last week that they had inspected 31 different places, and they went in and checked them out. Look, they had complaints from physicians and nurses and pharmacists and whistleblowers, but she didn't act on it.
Right. And what's been discussed and what's clear at this point, obviously the FDA not doing their job, but their job is frankly limited by law. It's supposed to be states that regulate this industry. They're the ones that really drop the ball. And pardon me, sir, I know you've probably heard this information, but I want to share it with our viewers. A report from Congressman Ed Markey's office, here's what it had to say, called State of Disarray. State boards of pharmacies generally do not know which pharmacies engage in compounding, do not know whether pharmacies ship compounded drugs across state lines, and don't know which pharmacies manufacture large quantities of compounded drugs. And again, from the same report, on average, states employ just 5 inspectors with responsibility to inspect all pharmacies. You drill down, 22 state boards of pharmacies do not keep any historical inspection records for compounding pharmacies. It's clear that the responsibility fell to the states. The states did nothing. People can complain to the federal government. Again, nothing happened. I see a lot of finger pointing here, Congressman. I see Republicans blaming the federal government. I see Democrats blaming the state. But what's getting done on this issue?
Well, there's 2 things that need to be done. One is the FDA needs to clean up their act. This is not just something that took place under Margaret Hamburg's watch, but actually the preceding the last 10 years, this has been a problem. And we want them to make sure they're giving us evidence that they're cleaning up their act. 2, we need to review what's taking place with the states. A lot of this is states' responsibility. My hope is the states step up and do what they're supposed to with pharmacies across this nation. The pharmacies do have guidelines. They have what's called the pharmacopoeia. So that's something else that Margaret Hamburg said they don't have. They do. There's a lot of cleaning up. And our role is going to be to hold the feet to the fire in this. We will also look to see, is there some federal regulations that are needed, particularly with compounding pharmacies that sell across state lines.
Because Hamburg today said we need more laws. Do we really need more rules, or do we really need regulators to just do their job, what they're required to make sure that drugs across the country are safe? Remember, 53 people died, hundreds of people were injured by this.
And from a very painful illness. Those states have to step up and do their job, and they haven't been. And the FDA needs to get out there and do their job. Every time Margaret Hamburg said they didn't have authority, we had another example of a place that she did go in and inspect. We will review those things. If there's a federal role for pharmacies that violate and send out these drugs without a prescription, or if they sell them across state lines, we'll review that. But we need to know the FDA is doing their job. And all they did is confound the issue today and say it wasn't their fault. They need more laws.
Well, I got to tell you, Congressman Murphy, we're all eager for this problem to be solved. Political finger pointing seems to be getting in the way. As soon as you guys can get some kind of resolution, come back on the show. Let's talk about it. Thank you.
We'll do that. Thank you.
All right.